Hi, I'm Lori Early. I'm a licensed acupuncturist, a board-certified herbalist, and a functional medicine practitioner in Houston, Texas. I'm the owner of Phoenix Rising Acupuncture in the heart of Houston in the River Oaks area. I specialize in chronic illness and autoimmune conditions, and seeing so many people who come in with chronic illness, one of the most common complaints or conditions that I see is hypothyroid, which is a low functioning thyroid. And it manifests as low energy, low sex drive, brain fog, maybe or maybe not some gut health issues, maybe some sleep issues, but overall just low energy and fatigue. And it can also manifest as like low mood as well. So what most of these patients don't realize when they come in is that 90% of the patients who have a diagnosis of thyroid dysfunction in the United States actually have an autoimmune disease. So instead of just targeting the thyroid, it's important to target the entire body, the immune system, gut health, etc. So one of the things that I talk to my patients about is the importance of understanding the role that gluten has on our thyroid. So what is happening when we ingest gluten and there's a hypothyroid or there's any sort of thyroid disorder is that the gliadin, which is the protein portion of the gluten, actually stimulates an immune response and an inflammatory response. The theory goes that the gliadin, which is part of the gluten, actually mimics the thyroid cells. And so when antibodies are made to created against the gliadin, then the antibodies are also created against the thyroid. So with every ingestion of gluten, there's actually an inflammatory response against that as well as the thyroid. So that just degrades the thyroid even further and puts you into a deeper, more profound inflammatory autoimmune state. So for my patients, I always suggest that when it comes to gluten, it is not an 80-20 rule where I'm mostly gluten-free. It's important that every hypothyroid patient do 100% gluten-free to save the health of the thyroid. There's several tests that we can run to determine the gluten intolerance, but pretty much, across the board, if you do have any sort of diagnosis of thyroid dysfunction, you might as well just go gluten-free. Another important thing to consider is that when you do ingest gluten, that the effects of the inflammatory response can last up to 6 months. So this is why it's important to go completely 100%, because even a slight ingestion of it can create an autoimmune response and degrade the thyroid anymore. If you have any questions, please leave a comment on this video, and I look forward to talking to you soon. Bye.